Okay, good afternoon, everybody. Thanks for hopping on. Today we're gonna just talk a little bit about 504 plans. This is part of our spring series. My name is Jackie White, and I am the Director of Outreach and Healthcare Access for the PEAL Center. I am happy you're here. Hopefully everybody can see my screen. Let me know if you can't. We'll start going through this just in an effort to be respectful of everybody's time. We appreciate you jumping on. Okay. So these are just a couple reminders. If you're able to, please keep yourself muted unless you want to speak. It just gets complicated when there's multiple people on if everybody is unmuted. You can use the chat to make comments or ask questions. We'll probably have some time at the end if there's questions. And we are recording this. We will send out the recording in our follow-up email after the session. So if you do want to ask a question or something later, we'll stop the recording, but please try to refrain from disclosing too many personal details. And if you need closed captioning turned on, please let us know. Heather can help you with that. I think you guys are all familiar with PEAL. You're all registered for the summer series, but just as a reminder, our mission is to educate and empower families to ensure that children, youth, and young adults with disabilities and special health care needs lead rich, active lives as full members of their schools and communities. All right, and this is what we are hoping that you are getting out of this little training today. We hope that you can better explain the purpose of Section 504 and Chapter 15 of the PA Board of Ed regulations that describe how Section 504 should be carried out. And we hope you can compare the differences between an IEP and Section 504 and how they work, and describe how children can be eligible for Section 504 accommodations and the steps that families need to take in order to get them. So let's go ahead and get started, get into this. So what is Section 504? Section 504 is part of the Rehabilitation Act of 1973 that prohibits discrimination on the basis of disability in programs or activities that receive federal financial assistance from the U.S. Department of Education. These two here are just describing the law a little bit, but Section 504 is a regulatory provision, and it defines physical and mental impairment as any physiological disorder or condition, cosmetic disfigurement, or anatomical loss affecting one or more of the following body systems: neurological, musculoskeletal, special sense organs, respiratory, including speech organs, cardiovascular, digestive, genitourinary, hemic, lymphatic, skin, and endocrine, and any mental or psychological disorders such as intellectual disability, organic brain syndromes, emotional or mental illness, and specific learning disabilities. That language is actually taken directly from the law. I'm getting ready to tell my co-host next slide, and I'm the one presenting. So, okay. Section 504 states, these are actual statements from the law, that no otherwise qualified individual with a disability shall solely by reason of their disability be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. And it prohibits discriminatory actions, meaning that a child with a disability should not be excluded from participation from some activity or be treated differently due to that disability unless it would be like necessary to ensure the equality of an opportunity. This is some of the legal language in the law. We'll unpack all this, but essentially not being excluded because of your disability or discriminated against is the reason for it. So 504 eligibility occurs because the student does not require specially designed instruction. So it requires schools to provide free and appropriate public education, which if you talked about IEPs, you've heard that term before, to qualified students who have a physical or mental impairment that substantially limits one or more major life activities. When talking about 504s, right, substantially limits is kind of the key piece there, and that SDIs are not part of a 504 plan. SDI is specially designed instruction. And we're going to discuss a little more about what substantially limits means in terms of what we have going on here. So, eligibility. For Section 504, eligibility is basically one prong, right? A student has a physical or mental impairment that substantially limits one or more major life activities versus an IEP, which is part of IDEA, right? And the student has an IDEA disability, which is one of the 13 identified disability categories. And because of that disability requires special education or specially designed instruction. So when we're talking about this, we need to think about what a 504 plan is, which is a formal plan on how schools will remove barriers so that a student can access their education and access the curriculum with accommodations like alongside their peers, their peers. It's typically thought of as how do we access the regular curriculum and the general education curriculum, like how do we remove barriers for students rather than, you know, redesign instruction as oftentimes happens in special ed. I'm going to bring up this document. I'm going to try. I admittedly was trying it before and it wasn't going well, so bear with me. I have to stop sharing and reshare, but this is a document that compares IEPs versus 504s. You're going to have this slideshow, so you're going to be able to kind of go through this on your own if you want, but there are a couple things that I wanted to point out. So let me see if I can get this to open. Stop. Heather, are you seeing it or is it still?
You're good.
The slideshow, we're seeing it? Okay. So this is a document put out by, it's called understood.org, and they actually are a great resource library for all kinds of things like this. But this is a very good comparison of 504s versus IEPs. And so we already talked about what a 504 plan is. This is the difference in the laws, IDEA versus the Rehab Act. You know, one's special education law, one's a civil rights law. The part that I really wanted to kind of turn your guys' attention to in this document is this section about what's in the plan. You can see that like related services, changes to the student's learning environment, modifications, how the student will be included in gen ed, talks about special education and SDIs in the IEP. In a 504 plan, though, they say it doesn't have to be a written document. Most times it is a written document, but 504s include accommodations, which are changes to the student's learning environment, assistive tech, and typically whoever is responsible for making sure that the 504 is put into place. Also, 504 plans, they don't typically have like goals that are being tracked and monitored. And this gets a little more in depth, like who creates the plan, could be any of these people. Parent and caregiver consent is required for an initial evaluation of the student, but the rules vary by state. But this is just a really good document to compare the differences. We'll get a little more into it, but I just wanted to actually open that and show it to you guys. So let me get back to my other screen here. All right, am I back, Heather?
Yep.
Okay, I can't believe that went so well. I'm so excited. When we tried it out, it was very confusing. Let's see if this will go to the next slide. There we go. All right, so how is a student eligible for Section 504? Okay, so they are eligible for Section 504 based on an evaluation, which parents can request an evaluation. Somebody at school can refer for evaluation, and you can request an evaluation in writing. But the evaluation has to determine that a student has a physical, mental, or mental impairment that substantially limits one or more major life activities, but don't require specially designed instruction. And then some examples of like a major life activity, we'll go into this more, but breathing, walking, paying attention, concentrating, reading, anything like that. And substantially limits is actually not defined in the law. So there's some openness for interpretation in that. All right, so what is the definition of a physical or mental impairment? It's what we went through before. ADHD, ADD, anxiety, those are sometimes things you'll see students having a 504 for, or them recommending a 504 plan for. Examples of body systems, we went through this before, but speech organs, respiratory, cardiovascular, digestive, lymphatic, skin, endocrine, muscular, skeletal, special sense organs. You'll probably need to provide documentation, like doctor's note, something written from a doctor, medical records. And I already said, like, mental impairment can be like anxiety, ADHD, things like that. In this, we're going to share this slideshow with you. In this, there's actually another document we have linked in the notes that is much more specific about some of this, but I'm just trying to give you like an overview. So, how is substantial limitation determined? This is where it gets a little bit tricky because it's on a case-by-case basis. So there's no real definition to substantial limitation. So during the evaluation process, they'll collect, input from families, input from teachers, other staff at the school that work with the student, doctors, medical professionals, and impairment in this case to qualify for 504 only needs to substantially limit one major life activity. And it can't consider, I'm trying to think of how to say this. It can't consider mitigating measures, right? So it can't consider like medication if it lessens the impact of the impairment. The exception to this is like contacts or glasses, but it doesn't mean that it severely restricts. Many students have a physical or mental impairment, but it doesn't limit a major life activity, and they wouldn't qualify. These are just some better examples of major life activities. I'm not going to read all of them. We touch on most of them. Communicating is another big one. Swallowing, sleeping, eating. Not an exhaustive list, but good examples. So chronic health conditions can be another reason that someone might need a 504 plan. And sometimes things to consider, and here on the slide, like frequent absences, it's important also to know that even if a student has a 504, it doesn't prohibit them from being evaluated for special education services if a need would change or be recognized. One of the things to kind of be aware of is blanket policies, meaning that if a student is having a healthcare crisis or they need to do like homebound instruction, oh, well, we only give 2 hours of homebound instruction a week. That's just what we do. Or students being required to make up all missed work, absences beyond 10 days need a medical excuse. Some things like that could work around this, like a student with ADHD and anxiety has had a 504, but since COVID, the anxiety has now impacted their engagement in school, or they're kind of refusing to do school. Now they might need an evaluation for special education services. An IEP might now be more appropriate. Or a student who is chronically late every day due to a medical condition, they might need some sort of accommodation that a 504 could address. So there are ways to discuss alternate attendance plans and all of those things, but these are just some points to look out for. So then we talk about specific steps, right, that schools must take. I don't know if everyone on here is familiar with child find, but child find is a federal requirement that public schools have a responsibility to identify, locate, and evaluate any kids who need special education. That's called child find. And under that requirement, students who are thought to have a qualifying impairment should be referred for an evaluation. And then teams will develop a written plan to provide free and appropriate public education, which is FAPE, right, in the least restrictive environment for students eligible under 504. So in talking about 504s, we're typically, again, talking about students being able to access general education and providing accommodations and removing barriers. This talks a little bit more about evaluation. So if a parent provides a written request for provision of services, Chapter 15 requires that schools respond to parents' written request within 25 school days. School days is important to note there. So parents, can submit something in writing, a letter, an email. I think email is probably more common now. And they might need to provide like some supporting documentation, why they're requesting this, submit medical records if they have them, physician's notes, external evals, whatever documentation they might have. The school has to respond to that within 25 school days. Now, Section 504 does not, however, specify a time period in which evals have to be completed. It just says, well, OCR, which is the Office of Civil Rights, just notes that there are various steps in the placement process, which includes evaluation, and those must be completed within a reasonable period of time. So 504 regulations also don't make them issue a full evaluation report, and just reevaluations have to happen periodically. Here's ways an evaluation can be initiated, and we talked about a little bit about this, but schools must get written parental permission for an initial evaluation. So to evaluate, parents do have to agree to and sign off on an initial evaluation. If a parent is initiating wanting an evaluation, they might need to provide documentation. If they don't have any, then they might need to get it. That's why it says provide medical documentation if available. And medical diagnosis alone, this is really important. Just because somebody has a medical diagnosis, it does not suffice as evaluation under 504. It has to have that substantially limiting life activity piece with it. Just a medical diagnosis is not going to qualify somebody for a 504. So FAPE accommodations are provided typically in general education classrooms, in specials, art, gym, music, extracurriculars, field trips, and other things. If a child is provided with an IEP under IDEA, then the 504 requirement is met, right? All of those accommodations and things can be written or already written into an IEP. So a student doesn't need both an IEP or a 504 and a 504 plan. You know, if they have an IEP, then those accommodations are already there. And then there are procedural safeguards. They're subject to procedural safeguards. School districts are required to establish and implement procedural safeguards that include notice. They include opportunity for parents to review records. And they can include, you know, if a hearing would be needed, an impartial hearing with opportunity for participation by students, parents, or guardians. And if needed, representation by counsel and a review procedure. And that is directly wording from OCR, which is, again, the Office of Civil Rights. This just goes back over what we just said about procedural safeguards. Again, there is another great, well, there's the procedural safeguards notice that we have linked here through ODR that you can look at later, but basically right to notice, right to review records, parents have the right to disagree, and a 504 is a legal document like an IEP. We'll get a little more into that, but if a 504 isn't being followed, there are things that you can do. Typically, we say try to engage with school administration, engage with the people responsible for 504 plans at the school and see what you can work out. But you can, like an IEP, you can, you know, go to due process, you can file an administrative complaint, and goodness gracious, if you have to, you can get to a lawsuit. So chapter 15, which is PA specific, requires that a service agreement be written for each protected handicapped student. In this service agreement, they have to outline the accommodations that were agreed to by the school and the parents. They're to be reviewed annually, basically to ensure that everything is still current. All school personnel that works with the student should have access to it or have a copy of it. This is one thing a parent can do, though, also to help check on things is make sure that everybody who needs to know what's going on knows what's going on. And they can absolutely be amended when needed. If you ever wanted to see a sample service agreement, there are documents out there. There is a document linked in the notes of this slide as well that you could look through. So parental involvement. So the LEA, which stands for Local Education Agency, or the school district, requires parental consent prior to providing services. Parental notification is required with a 504 if there's a change to the service agreement or if the student's eligibility changes. So they're no longer eligible, or we're thinking that they need to be evaluated for special education services, or there are accommodations changes. Any substantial change in placement requires an evaluation, and that requires parental consent. So those are just some things to keep in mind around parental involvement. And like I said before, and I think this is really important to remember because people think of IEPs as legal documents, but 504 plans are also legal documents. Students must receive all services and supports listed in the 504. All personnel should receive a copy and implement the 504 plan. And by all involved personnel, that can be anybody: a band leader, cafeteria staff, counselor, choir coach, anybody who works with the student. Parents should double check that all of those personnel have copies of the 504. And just know that if the plan is not followed, parents or somebody else, but parents, can file complaints with BSC, which is the Bureau of Special Ed Pennsylvania, or OCR. These are just, if you needed them, right? These are just the links to PDE or OCR. And then, to wrap this up here, and then we can talk, or I can take questions, or we can, whatever anybody wants to talk about, but just watch out for the red flag statements, right? So sometimes you'll hear like, we don't offer 504 plans in high school, or this is just how we do it. We do it for this way for every student. We can't make an exception for your child. Anything like that is, not ideal. These are supposed to be individualized based on the student's needs. Another red flag statement: your child no longer qualifies for an IEP, but we can give you a 504 plan. Again, it's not a consolation prize. It's what does the child need? How do they need to be served? How can they access their education? And this is just, if you need to get in touch with us, we can help navigate all of this. We have family resource specialists on staff that you can call and talk to. They can help navigate evals, navigate 504 plans. If we need to help navigate working with the school, we can help with all of that. And then that's just our evaluation. And I'm going to open it up for the chat. The recording will be sent out. We'll send out the document. Does anybody have any questions?